Thank you so much for having this hearing and for the privilege of allowing me to speak to you today. There's so much to talk about on this subject that I have supplemented my written testimony for this hearing with my written testimony when I appeared before Congress in 2012 and 2013. I testified on behalf of the Pitts-Udall bill, which was an anti-doping legislation, which essentially went nowhere. I've also included in the appendix a analysis that I was asked to write for the Commerce Committee on the Barr-Tonka bill, which is one of two horse racing anti-doping legislations that are currently pending. My summary on that, just so that you know where I stand, is that that bill is so seriously flawed that I actually think that it will make matters worse. I graduated from Tufts Veterinary School in 1985, so I've been in private veterinary practice for 34 years. My patients have included some racehorses that are in the Hall of Fame, and yet I regularly treat horses, attend to horses at every level of the sport. Rehabilitation and injury prevention has been something that I have focused my private practice on and my research from the beginning. And I had a unique experience when I was at Tufts Veterinary School because I was in such an early class that they threw us in with the medical students for a lot of our courses. And they actually allowed us to get our MDs if we chose to, but it would mean another year of tuition, and in a decision that only a 25-year-old can make, I decided that I would do all the clinical rotations that related to the work I was going to do: sports medicine, rehabilitation, orthopedics, orthopedic surgery, podiatry, exercise physiology. So I essentially kept getting in line, and I repeated all those rotations because I was learning so much that I knew that I would apply to my work with horses. I had ridden horses at a very serious level in show horse competition. So after about 4 years, I realized that I was not getting very good results. I had wonderful owners, had a Kentucky Derby horse in my first year of practice. I've had patients in every Olympic Games since 1985. And yet I found that the clients were far too willing to accept that these horses should retire from the sport even if they had a minor injury. You know, you can have a lesion, an injury in a tendon that's no bigger than your fingernail, and that can essentially mean the end of that horse's athletic career, which just made no sense to me. So I did a 3-year fellowship in human medicine, in physical medicine and rehabilitation with an emphasis on sports medicine, and transferred all of those methods in practice, the ones that would apply, over to horses. Absolutely everything changed. It's a different thought process. So armed with this new information, I went out, and about 50% of my practice is racehorse and the other 50 show horses. And so the services that I offer are all proactive. As I tell my new clients, an emergency call in my practice is, I just bought a new horse. It has the greatest potential, I've been told, for this particular sport, and it's completely sound. I say, let me get to the airport and get there, because this is when we have to start evaluating these horses in detail. And we need to know enough about what we're asking these horses to do. In racing, it's easy. They go once around an oval track with a very good surface. So we know from a scientific standpoint what we need to prepare that body to do. So if you have a health-centered veterinary service where your only goal is to optimize health, then that's when all the good things happen. But that's not what we have today. What goes on at these racetracks, and I know from personal experience with my own patients, is that the veterinarians have completely abdicated their authority as medical professionals and their duty according to the statutes by the Veterinary Practice Act. And what they do is they simply deliver drugs at trainers' request. I'm usually the reality check for a lot of these owners. Some of them have had racehorses since before I was born. And then I have to sit these guys down and say, well, I can tell you I was called in for this horse that's injured. Well, let's just take a look at the drug record. There are no medical records kept by these veterinarians. They weren't created because the service was never delivered. In order to administer, prescribe, or dispense a single dose of any drug, as a licensed veterinarian, you have to abide by standard of care. That means I have to start by taking a history. Then I have to do a complete physical examination. I need to make a diagnosis. If I need certain diagnostic testing means to make that diagnosis, I have to employ that. Once I've made a diagnosis, I have to come up with a therapeutic plan. That may involve drugs, it may not. And please don't let anyone tell you that a drug is in and of itself therapeutic. It's the context in which any drug is given that determines whether or not it's therapeutic, or what I call anti-therapeutic, because it not only doesn't help, but it actually makes things worse. Let me give you an example. In racehorses, they commonly develop acute traumatic arthritis. So that's just part of training. All that has to happen is the horse does a little bit more work, the track comes up a little bit hard, no big deal. The joint just has a minor inflammation. So certainly giving an anti-inflammatory to that patient is appropriate treatment for that, but only if it's in the context of that horse resting. What you can't do is give that drug and then say, keep training, keep racing, but that's what happens at these tracks. I had so many horses leaving my practice in Florida or Kentucky and coming up to New York. And by the way, New York is no worse than any other place, but I simply wasn't following them so that I couldn't essentially monitor everything that happened to them. And so many of these horses had the kitchen sink of drugs dumped into them within days of arriving at a racetrack in New York. I would ask owners, please make sure that any veterinarian that treats your horse, just have them work with me. If they've made a diagnosis, please have them call me. We're glad that they're offering a service, but keep me involved. No phone call would ever come. I had clients that sent registered letters saying, it's my right as an owner to insist that you send the medical records to Dr. Lyons. Never had a single record sent. When I would finally, in some cases, be able to track some of these track practicing vets down, one guy said to me, oh yeah, no, I got that letter. I didn't know what you were asking for. You should just ask the client. It's on his bill. But if you, oh, that horse is with that trainer, well, I can tell you what that trainer likes to use. So drugs are not being used therapeutically, and that absolutely contributes to the completely unacceptable development of these injuries. And in response to Dr. Palmer's, something that he mentioned, I was very happy to hear him say this, and this is included in my appendix as well. For all of these years, we were getting, it started in 1992, when a client of mine, Phoebe Hurst in California, became a racing commissioner, and she called me and she said, so what can we do about safety in racing? I've been made a commissioner. And I said, necropsy, mandatory necropsy programs. We've got to figure out why these horses are dying on the racetrack. So that was when that first began. So for 25 years, here's the bottom line of what we've learned. Pre-existing injury is the reason for the majority of catastrophic breakdown in these horses. That's good news. The reason it's good news is that we can detect pre-existing injury. Now, it's true that standard X-ray is proving to be insufficient.
I'm going to actually, you have about 2 minutes. I'm going to actually.
Oh, okay. So every year I go to the annual conference in human medicine that is the one that I did my fellowship training in. So every year I'd ask, I need to be able to image horses. I need to be able to find microfracture and edema and all of these problems that are hard to detect. Every year they told me the same thing. We wish that we had that too, but we don't. Well, in 2014, in December, the former head of this academy made a beeline for me in the reception area, and she said, ask me your question, you're going to like my answer this year. There was a new kind of CAT scan, she's the head of a department at Mayo Clinic, a new kind of CAT scan that can image the standing patient. So that, of course, is necessary for horses. Long story short, I've worked with the company. We can image a horse from above its knee or hock all the way through and including the hoof. It can detect the microfractures. Through artificial intelligence, the computer can automatically tell us what bone density is, how thick the bone is, whether or not it's adapting to training, because these injuries that these horses are getting are actually part of the natural process of the body adapting to increasing training and racing. So we need to stress it and then rest it. Well, this CAT scan can do this. So what I've proposed is that we do a pilot study at a racetrack, but we need to be able to scan all horses in training repeatedly so that we can begin to collect the data and help the regulators.
We're going to do questions. So I want to thank you because starting on page 5 of your testimony, you did give ideas and reforms. So I want to thank you very much for that. We have questions from Senator Martinez.
Thank you for your testimony. There's a lot going on in my head in terms of your testimonies, and I wasn't able to ask this to the Gaming Commission, but you spoke about therapeutic drugs, and the Gaming Commission also spoke about there is a period right before the horse will be let out or in the medical area where they are administered certain drugs. The quote-unquote, you're saying therapeutic drugs, is it a claim that it will help them ease their run? Is it something that the trainers feel that this horse will then have a better race? I mean, what's therapeutic about it?
Exactly. That's my point. It's not therapeutic if it's given to improve racing performance. And there have actually been successful criminal prosecutions of trainers and where veterinarians have actually made a plea deal because they consider it under the DEA regulation to be misbranding if a drug is used for any other purpose other than what it's approved for. Well, racehorse is not a diagnosis. So you need to make a diagnosis before you can decide what drug may be therapeutic. And if we're talking about anti-inflammatory pain masking medication, then that's in conflict with allowing a horse to continue to race or train. So that's why I say it's very dangerous when, and I understand the reason behind it, when racing and wagering boards and other associations want to come up with a list of what they call therapeutic drugs. Well, they're therapeutic under one context and they're actually harmful in another. You'll notice in New York, they will publish the drug logs, I think it's 48 hours before the major races. I'm sure they'll do this before the Belmont Stakes. And I always look at these logs because the veterinarians, the slip actually asks for a diagnosis. Veterinarians often write pre-race, or as Dr. Palmer said, racing is not a medical condition. So right there, they have violated the Veterinary Practice Act. So they have not met the standard of care. And if the Veterinary Licensing Board were contacted by an owner, if a complaint were made, if their only justification for giving a drug is that it's in the race tomorrow, then that fails. I met with the veterinary board because I was so concerned. I felt like I had to come up and be the police for my patients. One owner wanted to hire me full-time to do nothing but follow his stake horses around to stop veterinarians from harming them. That wasn't a job I was interested in doing, so I met with the veterinary board and I said, please help me. This is what happens. I have the records to show these horses were in perfect health. I monitor them in ways that others don't. They crossed into New York, and within days, they had multiple joints injected. They have multiple nonsteroidal anti-inflammatories. They were receiving corticosteroids in their feed.
So I think that's my concern, correct? In
Yes.
terms of who is monitoring these injections, who is reporting these injections, who is mandating that these injections be given, and are they being injected with too much medication? And obviously, look, we know this is a big industry for the state of New York, and it's something that we do not want to kill, obviously, right? But we also have to make sure that our horses are taken care of, and that they are treated properly and humanely, regardless whether they're racing or retired. And it goes back to the investigation the investigation portion of it. I do not think there is transparency.
Right.
And I think that's something that we need to work at. I think this is something that we should know what is happening on those tracks prior to the horse coming out of the gate and after it completes his run, right? Because I think we're not getting the full story of what's happening.
Exactly, and when I had that very productive meeting with the veterinary board, they were sympathetic, they wanted to help. One of the good things that came out of it is there was a veterinarian who was recently going to have gone through all the positions in the vet board, and he was retiring from the vet board. He used to be a racetrack practitioner. So he actually, when I made my presentation, he said, you don't know the half of it. And then he contributed to what he knows goes on at these tracks. So what came out of that is he came up to me and he said, look, I would agree to be a liaison between the veterinary board and whether it's the Gaming Commission or NYRA or whoever would have this investigator, and remind these veterinarians that you can't give a single dose of any drug to any patient without keeping a comprehensive medical record, without having you examined that horse, and they can start yanking some of these licenses. But the security of a racetrack, I give them the benefit of the doubt. It's for very good reasons. Part of it is that it's gaming, so you want to make sure no one from the public can go into the grounds and interfere with the outcome of a race by doing something to a horse. But what it has turned into, it's like the old movies where the last person to leave the bank locks the door and he doesn't realize that he's locked the bank robber inside. And that's what happened. I think despite your positions here, if any one of you just showed up at a racetrack and said, I'd like to go in, I'm a member of the Senate and I'm on this committee, I think they'd have to make several phone calls and try to figure out, under what context you're going to be able to go in there. So your answer is, not only is no one monitoring this, but no one can have access to know what's going on.
And I appreciate it, and I think that's why we're having these hearings, right? We just need to
Yes.
hear from individuals, but I have also...
Senator Boyle.
Thank you, Chairman, and thank both panelists, really insightful testimony. Dr. Lyon, I just want to get back to your point about the new CAT scan
Yes.
machine. Do they have any of those in New York that you're aware of? Is just a Mayo facility? Is there only one, or is there a bunch of them?
Oh,
Yeah.
in human medicine,
Yeah.
they deployed this in 2015, so they have units
Yeah.
all over the world, and
Okay.
I've worked with the first physician users of that device so that I have learned with them, because
Okay.
so much more is being revealed on these scans
Right.
that they've now had about 5 years to figure out how to interpret those findings.
Okay.
So I've kept up with that. Now, the equine scanner, all we have is a design for it, but I need the funding, or someone needs the funding to build the prototype and to deploy it.
Okay.
Now, the technology is there because it's there and it's tested and it's the same as their human technology.
Right.
But I sent this proposal to the Gaming Commission Racing and Wagering Board. I sent this to NYRA. Didn't hear a word back. And yet, as I say, it won the audience award amongst racing commissioners and authorities for the best innovation to improve the sport of horse racing. I thought that that meant it was going to launch. And yet I do understand some of the concerns. What some vets have told me behind the scenes is they say, look, what happens if we deploy this and we find this subchondral pathology in 50% of the horses? What are we going to tell the racing secretary? And I think we are at a point in this industry where we can't worry about that anymore. I think we need to understand where we are in terms of bone health with these horses and to start to figure out how to manage our way out of this.
Yeah, I thank you, and I agree. I think obviously the horse racing industry in New York State has some big issues, huge issues. I mean, Saratoga being the exception of a profitable, popular place, but the downstate tracks are having a very difficult time. If it wasn't for the casinos sitting next to the track, there probably wouldn't be too many people there.
Right.
And with these death and traumatic injuries, it's just adding to the problem, obviously, and less people want to go. You don't see many people in their 20s and 30s at these tracks. I would hope now, do you know approximately how much? We're talking about $5 million to make this adjustment?
No,
or-
actually, agreeing to work for a first-year graduate salary and actually take a sabbatical from my practice. The entire project, which builds 2 CAT scans, one I guess they have to send to a testing lab, and they say they have the lab beat it up so that they get a bag of parts back, and then we'd have one to deploy.
Right.
That's a $2 million project, including buying the CAT scan and hiring the staff to run it, scanning every single horse at any racetrack for a full year.
Right.
That's it. My guess is that NYRA spends more than that on PR.
No question, absolutely. And for $1 billion industry in New York State, well worth it. Thank you.
Right, thank you.
Take the offer, Ms. Kane. Thank you so much.